All right. Well, welcome everybody to the About podcast, where we aim to help educate on all things financial and life. My name is Jeremy Scott, one of your amazing hosts, and of course, joined by my fellow amazing host, Roy Hookey. Roy, how you doing today?
Fantastic. I'm really excited, actually, which is really funny to say because our topic today is not one that is overly exciting, but it's really important.
We like to focus on the really important but unexciting and sometimes like uncomfortable. And we're going to do that today by talking about insurance, that thing we all need that hope we never need to use, but inevitably will at some point. And I'm not an expert in this, and Roy's not an expert in this, but we have an expert in this with us today. We're very grateful to have Kent Madsen from KDM Insurance here in northern Colorado, outside of Fort Collins. Kent, thanks for joining us.
Thank you. Thanks for having me.
No problem.
So typically, Kent, we want to know a little bit about you. Let's just give us your little background story. How did you end up where you're at? That'd be really great to start with.
Awesome. So married with 3 kids. They're all grown up, left the nest, so we are empty nesters now. And as you can tell from some of my gray hair, I am approaching the Medicare age myself.
There you go.
But came out of working for hospitals down in Denver. That career cycled out. I got kind of tired of doing that. Created
In the insurance side for hospitals, like the health insurance company, dealing with health insurance companies and billing and that kind of stuff, or what part of it?
One of the things I did for the hospitals, I negotiated their contracts with insurance companies.
Got it. Yeah.
And so it kind of led me down that path. I felt I was good in that, and so felt comfortable moving into setting up an agency about 16 years ago. So,
okay. Well,
so I've been doing it quite a while.
Okay. And what sort of insurance products do you focus on?
Now I focus on small group, individual, so those clients that need coverage through Connect for Health,
right,
as well as Medicare.
Okay.
So the topic today is the world around Medicare.
The world around Medicare.
That's really what we're kind of focusing on. And Kent being that expert, it's really there's a lot of things you can stub your toe on if you don't actually think forward. And the planning piece of what I do is what drives me to someone like Kent, because he wants to make sure people have a plan for their insurance side of that, because maybe one of them's in Medicare age and if you're a married couple and one of them are not.
Right.
How do we deal with that? And this is Kent's forte. And we've been working together probably a good, 6 or 7 years now, it seems like. And I started my business 15 years ago, so we finally bumped into each other through this thing. So This is fantastic. So that's really the goal today, is just to educate people around Medicare, all of the pitfalls. There's some actual things coming up that Kent's going to make us aware of for next year that's coming down the pipe. And really excited to hear what you had to say, Kent.
Nice. And my assumption is at 47, I don't need to worry about Medicare at all at this point. There's nothing for me to do, correct?
Correct.
Okay. No, that's
So, Kent, why don't you start with the concept of, so just for our basic knowledge is, how does Medicare work? Lay that just high-level table for us, and then we can kind of talk about the nuances around it.
Good. So Medicare consists of 2 parts, Medicare Part A, which covers inpatient hospital. That typically is free or zero premium for most Americans because they've worked 40 quarters or 10 years, or their spouse has, or in the case of people who are divorced, they can claim that on a previous spouse.
Oh, okay.
And then there's Part B, which covers all things outpatient. There is a premium associated with that, and that's where the biggest weakness comes in Medicare. It's why most people need to look for either a Medicare supplement or a Medicare Advantage plan. And that biggest weakness lies in the area of Medicare covers 80% and the client will cover 20%.
For outpatient?
Yeah, but it's unlimited.
Oh.
So if you have let's say a $10,000 or $100,000 year on the outpatient side, you're at risk for that 20%. There's no limit. We'll cap out.
Yeah.
If you don't have a supplement or the other alternative, which you said was Advantage.
Correct.
Okay. So then what age does Medicare apply?
So it starts at age 65. Unless you're disabled, you can get it a little bit earlier than that.
Okay.
And people can choose to not take Medicare if they are working for an employer and want to continue with that coverage.
Oh, okay.
Yep.
But when they retire, do they have to go on Medicare?
Yes, very, very important. And so to apply for Medicare, let's assume that somebody's approaching age 65. You can start that process about 3 months before you turn 65. So let's say you're turning 65 in June, your birthday is June 15th. Medicare will actually start June 1st. And if you back up 3 months from that, so May, April, March, right? You can apply for Medicare in March, goes into effect June 1st in that example. And then you can apply the month of your birthday or 3 months after.
Right. And if does it change at all if you're working in retirement?
Yes. So you can continue on with an employer's insurance. The key to that is when you're going to come off the employer's insurance, you want to start that process about 2 months early.
Okay.
So if you know your insurance is going to end, start thinking about Medicare 2 months before. And the reason why I encourage everybody to start early is Medicare can sometimes take a month to process, right?
What? It's the government. It happens really quickly, right?
I thought they were efficient.
They're very efficient.
So, and if you do extend with an employer plan, there are certain forms that you need to have filled out, and one of them requires a sign-off from your employer. So if you don't sign up for Medicare when you turn 65, you would normally get a penalty for not signing up for Part B, and then there's a Part D, which is the prescription drug plan. There's a penalty on that as well. So these forms that you get signed by your employer are sort of a safe harbor that can help you avoid those penalties. So again, when you consider maybe a week to get your employer to sign a form, then maybe another 3-4 weeks for the government to process stuff, it's just important to start early on that stuff.
Sure. I think in my life, we have lots of examples of the opposite of that as far as employer coverage goes, because people might not know this, but clergy are a rather unhealthy bunch of people. So our insurance in this part of the world, especially amongst my peers, is really expensive. So I know people, they turn 65 and they'll retire so they can basically go on to Medicaid and then get appointed back to their churches as a retirement appointment, which no longer carries the requirement that they be on the group plan that all the rest of us have to be on, because at the end of the day, it's actually better for them to be, paying, getting Medicare and then paying for a decent supplement. They're actually end up with better coverage for a whole lot less money. Right. So it's a fairly common thing. You'll see people, get reappointed back to their churches and nothing really changed other than they entered a retirement status. So they didn't have to have the employer coverage anymore and they could have Medicare because it was actually an improvement for them with the supplement than what they were getting now, cost-wise especially.
Right. So if you're continuing to work past 65, then how do you kind of evaluate, should I go on Medicare or should I keep my current insurance? Like, how do you evaluate that?
That's a great question. So it really comes down to the numbers. So your group plan is going to be charging you a premium or a contribution, right? Mm-hmm. Plus your employer is going to be kicking in some. So it comes down to what are you expected to pay if you go on Medicare, and what's your employer charging you out of your paycheck? So that's the one way to analyze it. But the other way then would be, what are the benefits that you're getting? So if you have an employer plan that has a $5,000 deductible, let's say it's a health savings account, maybe you can get a lot better coverage by going on to Medicare if it's the same price. Right. So it really does come down to what are the numbers on both sides of that equation.
Mm-hmm. So is that the kind of client that you work with that needs help with evaluating that? Or do you have some sort of tool online that they can use or some fancy thing?
There's so many moving parts that I'm a little old school. I do like sitting down with somebody or doing a Zoom call, right?
It is the 21st century.
Yeah.
Yeah, and traffic.
And post-COVID, man, Zoom calls.
Right.
Sign me up.
Right. Yeah, so there's so many moving parts, right? Like as you mentioned earlier, somebody might have a spouse, right? And maybe the guy is 66 wanting to retire, but the wife is still only 62 or 3, something like that. It's really key to roll up your sleeves and figure out each situation, because it can be different, right? And we haven't talked about that at all, but in the individual market, for people that are under age 65, you can get tax credits, and sometimes they can be significant. So it's really nice to be able to work with a financial planner and maybe a CPA, a tax planner, where they can go back and talk about, what is my adjusted gross income going to be this year? What do I think my tax credit could be? Is there a way to configure my income this year to be more or less, right? That could affect a tax credit.
And the tax credit for?
Well, so in the individual market.
For the individual, so if buying a part, like if you're going to buy a policy on the individual market, getting a tax credit that'll cover part of the cost.
Yes,
okay.
You got it.
I have that for my kids right now.
Yeah.
Because they actually are on their own, because the cost of adding them to my policy, which is already prohibitively expensive in my opinion for me, super prohibitively expensive to add them to it. So they're on their own, that we purchased through the marketplace because we got a tax credit, as part of that, which covered part of the premium. Even without tax credit, it was still cheaper.
Right.
But
And for Jeremy, that would be his tax credits determined by his adjusted gross income.
Correct. Yep.
Got it.
So there's a whole system around that as well. You have to look at the whole family's income. Typically, if you have access to a group health plan, you're not eligible for a tax credit. And so again, each calendar year is a new segment of time that you can look at for tax credits. So if somebody's retiring at the end of the year, say October, but they've made all that income up to October, then sometimes it's best to consider maybe staying on COBRA, right, for that spouse. And another situation might be they've met their deductible for that year. So staying on COBRA might make most sense, even though the premium's a little bit more. And then the next calendar year, take a look again at what's their income going to be that segment of time, and what would be the corresponding tax credit.
Right. So for the tax credit piece you're talking about, it's the income in the current year that they're applying for it?
Correct.
But then for the Medicare premium that they could pay, is that also the current year's income, or is that?
So the Medicare premium is just the Medicare premium, whatever it is that year.
Okay.
So in 2024, it happens to be $174.70. So you have to pay that no matter what once you go on Medicare.
Okay. Is that for the Part B?
Yes.
Okay.
And can it be more expensive than that?
Yes. Good, awesome question. So there's things out there called IRMA adjustments, and it's an acronym for IRMAA. Stands for Income Related Medicare Adjustment Amount. There are 5 categories of income, right? So if you're married filing jointly, the cutoff is $206,000, and if you're single, it's $103,000. So if you make more than that, you're going to get an adjustment to your Medicare Part B premium, so it'll go up.
So kind of a people who can afford more. The idea being, I'm sure the logic behind it is people who can afford more pay a little bit more.
Right.
So those who can't afford as much pay a little less. I mean, it's kind of
and it
maybe not great, but it's understandable. I kind of get that. I can understand the logic.
Yeah, I always say hey, listen, it's my job just to warn you of those. A lot of people will say, I don't make that much, but then they'll forget that they maybe sold a rental home or something like that. And it's a 2-year look back. So IRMA adjustments look back 2 years. So in 2024, they're going to be basing your IRMA adjustment on what you made in 2022.
Gotcha.
So sometimes people get bonuses or, golden parachutes, that kind of thing, and they don't think about that.
Right.
So really, when you're going into Medicare, it's your income really at age 63 that will potentially determine what your premium would be.
Yep.
And if you're still working and you made good money, it might make sense to stay on your current policy.
Correct.
Versus going on to Medicare at that point in time.
Yep.
Right.
But if your income's going to be high anyways, it's like,
yeah.
Either way you might be getting, and I look at it as a tax, it's just a tax.
Correct.
You're paying a higher premium that's a tax because your income's too high.
Right.
Yeah.
Is it max out, or is it like a sliding scale?
It maxes out at $750,000. So
is the premium max out? or is it like a percentage thing?
No, the premium maxes out as well. So I think it maxes out at about $600.
Not nothing. I mean, that's
per month,
100
per month versus 175.
Yeah,
basically.
that's a big difference.
It's a big difference.
Big difference.
Yeah, but if you're making that kind of money, then it's a little bit of the tail wagging the dog,
Right.
right? There's nothing you can do about it.
Right.
Although I have had a few cases where people have appealed it and won. So if you're laid off or something happened in the past that was unique, and you don't have that money anymore, you can appeal an IRMA adjustment. And I've had a few people win those.
Well, it's still less than I pay a month for my insurance.
Yeah.
Yeah, no,
Yeah.
right.
Yeah.
Let's work at Stiffs.
Yeah, poor guys.
So, okay, so that's important. I just want to make sure that people understood, like, this is the planning piece, okay? So you have age 63, you're going into Medicare. You have to be aware of certain things like the income levels to know, like, hey, it's not as simple as going into the year and just applying and you're good to go. I mean, it has a lag indicator. Another thing around it I was curious about, because I ran into this recently, if you have an HSA and you go on to Medicare, are there any kind of weird nuances there?
Yes. Another good question. So the government doesn't want you to contribute to an HSA if you're within 6 months of being eligible for Medicare Part A. So you want to
and because the HSA, to be clear, I always get this messed up. The HSA, the health savings account, is the one where you put the money in, but it also you can accrue. It's not the HRA where it disappears or whatever. It's the money that you can put in that accrues over time, and you can build it up over time, and you can put so much amount in every year, and and eventually you can get a little interest on it and all that. So if you're at 65, you've had an HSA for possibly a number of years now. There's a chance that you're going into retirement with a decent amount in there if that's what you prioritize saving in there. But you don't. It doesn't go away. That's your money. So that's the savings account version.
It's tax deferred money, so you've never paid income tax on it.
Right.
And if you spend it for health purposes, then it's never taxed.
Okay.
That's
so
a big appeal.
6 months prior to retirement, they want you to stop doing that.
Correct.
Okay.
Yep.
Why?
Well,
tell us more, Kent.
The why is obvious.
Riveting.
It's probably somebody above my pay grade that could answer that.
Because they want to tax us, Roy.
Yeah. So the thing to do would be to stop. Now, I would say this. In my experience, I've never had anybody audited on that and have to pay it back, but it doesn't happen that often as well. So
if somebody accidentally there's no notification that this thing even exists, right?
Yeah, I'm like, how would I even know?
Yeah, you
like
don't.
It's automatic. Right now, it's automatic on my thing. It's just part of my.
Yeah.
I mean, I wouldn't. How would you even know to turn that off?
Well, I will say this: if you apply for Medicare and you go down to the local Social Security office and apply there, they will ask you that question.
Oh.
And they'll say you either can apply or you need to go back and transfer those funds back out of your HSA.
Interesting.
So they do ask it that way, but they don't.
I'm just pointing to the camera to let everybody know it's. I don't think it's showing what you want to show, Jeremy.
I don't think it is. That's why we got multiple cameras going.
Interrupt everybody.
We got multiple cameras going for that very reason. Don't worry about it. See, I don't like this one. This one tries to be smart, and it's kind of dumb. So it's all right.
You have to put that on your YouTube channel. So Jeremy does have a YouTube channel that he reviews cameras.
Oh.
And it's actually pretty big deal, actually.
We do okay.
Sounds
we
like.
do okay. We're okay between the two of us because that one's got me and the other one's got you, and this is more editing work for me.
Sorry, I didn't mean to interrupt.
No,
derailed everything.
No,
just want to make sure you're getting what you want.
Yeah, we'll figure it out.
Yeah, so be careful with HSAs, I guess is the point. And if you want to be legit, don't contribute within 6 months of turning 65.
Okay. Now I very much understand that there's the conversation around, cost, premium cost, what's that going to be? And then there's the out-of-pocket cost. So knowing that, you want the 20% and copay basically that never goes away, which is kind of a big deal. What about one thing that comes up a lot with insurance too is also acceptance. Are there places that don't take Medicare? I mean, is that a concern that I'm going to because I've had that where I've switched from, Blue Cross Blue Shield to United Health, and suddenly my doctor is out of network.
Right.
And that was kind of a pain in the rear.
Yeah. So really, what we're transitioning into is if somebody is on Medicare, they could select either a Medicare supplement or a Medicare Advantage
Right.
plan, right? And the biggest difference there, well, there's several differences, but one of those is when you go on to Medicare and you select a Medicare supplement, okay, you will use the original Medicare network.
Mm-hmm.
So if you go the route of a supplement, the only question you really have to ask in terms of is my doctor in network is, do they take Medicare?
Right.
So when you choose a supplement, you have access to basically the broadest network that's available out there.
Okay.
So, and where it really comes down to the most meaning for me, anyway, is those centers of excellence. So think of places like the Mayo Clinic, Cleveland Clinic, Texas Heart, right?
Right.
Cancer Treatment Centers of America,
Right.
in
MD
Oklahoma.
Anderson, those kind
Yep.
of places. Yeah.
So when you approach those places, you just ask, do you take Medicare? If the answer is yeah, you can go there.
Right.
So it's the broadest network. And then along with that, Medicare supplements do tend to have the best payment in terms of how they cover your services. So
Okay.
you can get a Plan G. So imagine somebody's 65 years old. They're going into the later stages of life where things start to happen. If you have a Medicare supplement Plan G, your risk going to any of those places that we mentioned is the first $240 in 2024.
Oh.
That's the Medicare Part B deductible. So where in the United States can you get a plan like that? Right?
Yeah.
So
How do you determine, what are they paying for that supplement?
So-
Plan G supplement,
Yep.
right?
So Plan Gs, they'll start for a male, non-smoking, and again they go by zip code.
Okay.
But Northern Colorado, a male is going to be around 145 in that, plus or minus $10 to $15, depending on if you go with United Healthcare or there's about 4 or 5 that I represent.
Okay.
Females tend to be about $20 cheaper. So
Yeah. Well, that
so
makes
for
sense.
a male, you're looking at $1,800 a year roughly,
yep,
and that beats paying 20% out of pocket.
correct.
Okay.
Yeah.
I like that.
I
I like
like
that trade-off.
That's a good plan.
Yeah. Well, it's the richest plan that you can possibly get for somebody that age,
Right.
With that kind of access to providers.
Right.
So do your premium go up every year
Yeah, absolutely.
as you get older because there's higher probability you're going to need it?
Yeah.
Yep. So just think about a Medicare supplement. Think of it as a wagon that follows behind Medicare. So it has to cover those gaps in Medicare, and the only way it can do that is with your premium.
Right.
So as you get older, your costs are expected to go up, so your premium is going to go up.
Right. Yeah, because there's the more likelihood that you're going to get that, larger bill
Right.
for something. And I think I wonder today, like where they're pushing more stuff outpatient.
Right.
You said the inpatient stuff is all covered, but they don't keep you inpatient anymore unless they really, really, really have
And they
to.
get penalized if they do.
Yeah. So as they push more stuff outpatient, on one hand, it's convenient. You're not spending nights in the hospital, and people like that. But my fiance just had a hip replacement, and it was outpatient. She didn't stay the night in the hospital as part of
Right.
that because they don't do that anymore.
Right.
But I didn't even think about but that's a different thing now.
Right.
Okay.
Yep.
Huh.
So you said Plan G, and are there other options for supplements?
Yeah, I have people mostly focus on Plan G and then Plan N. N is in Nancy as an alternative.
Mm-hmm.
It knocks off roughly $15 to $20 a month, and instead of that benefit or coverage being $240, right, as a deductible, and then you're done. Plan N will add copays if you go see a specialist or have an emergency room visit.
Oh, okay. Yeah,
So
yeah.
if you're healthier, maybe you want to buy N just because it's maybe a little bit less, and you
Correct.
don't expect to pay those things. But
Yeah.
Right.
if you're not, then you go with G because I'm probably going to be paying this out of pocket.
But even then, worst case, you're out of copay, which is not. Again, hopefully not anywhere near 20%.
Right.
Especially for those larger bills. So yeah.
So that's one avenue.
Mhm.
Again, people approaching age 65, I say there's this fork in the road. You have to consider a Medicare supplement, but then there's this other program called Medicare Advantage, and sometimes it gets a bad rap. However, half of Americans that are eligible for Medicare are in a Medicare Advantage plan.
Oh, okay.
So that's a big number.
That's a big number.
And moreover, probably I think that the number is 70% of Americans that are rolling into their age 65 are enrolling in Medicare Advantage plans.
Oh, okay.
So there's something about those that are intriguing to Americans.
Sure.
Right. So, and obviously I represent both of those, but so to consider a Medicare Advantage plan, they do get a bad rap. If you want to, go on social media, there's things that are being said that are negative. However, a lot of those are unfounded.
Okay. I also feel like there's a lot of advertising. I like that. Medicare Advantage is one I've heard of because even at my age, because I feel like there's just a lot of ad dollars out there around it, which maybe is always a little kind of off-putting to some people.
Right.
Yeah.
So Medicare Advantage plan, essentially, the insurance company takes over their network. So you're not using the Medicare network anymore. You're using the Medicare Advantage plans network. They have HMO products. They have PPO products.
Okay.
So HMO requires you to stay in network for elective procedures, but you can, travel around the U.S. and use the emergency room or urgent care benefits or ambulance.
Right.
Or if any of those result in a inpatient stay, that's, that would be covered by the HMO. But if you want to go, say, to Florida and see orthopedic doctors down there, then sometimes a PPO plan would work better.
Right.
So.
Yeah. See, I have a case where my future mother-in-law lives in South Carolina, but she's here a lot. And actually one of her doctors is here in Colorado.
Yeah.
And I think she's on a traditional Medicare plan, which lets her kind of go back and forth. So she would not be a good candidate, I think, for an HMO plan because she's not, she's been 6 months of the year, 3 or 4 months of the year. She's off other places visiting grandkids and kids and, all that kind of stuff. Yeah.
So the Advantage, the G, the N, they're all tools, and I think that's one thing people need to remember is that it's a tool that could be used, and depending on your situation, means it could be good or bad for you.
Right.
So that's where the planning piece comes in, to talk with an expert like yourself to say, hey, if you are going to be traveling, maybe that Advantage plan isn't the best option for you. Maybe you need to consider something else. Or if you are, hey, I'm not a traveler, I'm just going to really be in northern Colorado for the most part, or wherever you live, maybe Advantage makes sense.
Right.
And now I did have some clients say a few years ago, and I don't know if it's true anymore, but Advantage was no out-of-pocket premium. Does that still exist?
Correct. Yes.
Wow.
So that's why I believe a lot of people are choosing that.
Okay. I was kind of curious. I was kind of preempted my question. I was like, so why would you? Okay.
Yeah. Yeah. So their claim to fame, zero premium.
Okay.
And there's a plan out there with Devoted Healthcare that gives you $130 back towards your Medicare Part B premium.
Oh.
So wow.
So for people that are super healthy, I have a veterinarian that can take care of herself, right? She loves the give back plan, is what they call that.
Now, can you switch back? Can you start an Advantage plan at 65 and then change later on to a supplement, or is it one of those make a choice now and forever hold your peace?
Yep, fantastic question. So, if you start off on a Medicare supplement plan with that premium, as long as you pay that premium, they have to keep you. They can't terminate you.
Okay.
If you start off on a Medicare Advantage plan and you get a diagnosis, I tell people if you get a diagnosis you don't like, at that point, you have to fill out an application and go through medical underwriting with that Medicare supplement carrier. So if you get a diagnosis you don't like, they may not like it either, and they can reject your application. So as you're turning 65, I think it's really important to look at Medicare supplements, look at Medicare Advantage plans, look at, what's your family history, right? And just make a good decision.
You mean after you've already been on so if you've been on an Advantage plan even for a while?
Yeah.
So you can get basically dropped.
Correct.
Okay.
Opposite.
Yeah.
So Advantage allows you to stay on it, but it may not be as robust as what you want if you're diagnosed with something.
Yeah.
And if you try to go to those other G or N type plans, they're not going to potentially take you because they would have to underwrite you.
Oh, okay.
So if you choose those, if you choose Advantage, that's a downside. But if you're in the G or the N,
they have to keep you.
They can't drop you.
Got it. Okay. Yep. I was hearing that wrong. Perfect.
And there's two situations when you turn 65 and when you come off an employer plan. you don't have to go through medical underwriting to join a Medicare supplement.
Okay.
You just sign up, no questions asked.
Right.
But once you go down the road, then those things come into play.
Right.
So if you have health issues, you really got to think through this. And does the advantage savings of dollars in your pocket today make sense for your health long term if you have some problems? And really look at your situation. But that's what's case to case. I mean, you got to look at this. And if you have a married couple, you could have one advantage and one not advantage.
Yep.
So you can kind of choose how you want to do that.
Yeah, the only advantage you get if you have a married couple, a lot of times the Medicare supplement will give you a family discount.
Oh, okay.
Maybe $15 off each policy if you both sign up for the same Medicare supplement plan.
Well, and that's one of those things with long-term care insurance that I do a lot of education around for people is married couples are healthier than single people. So I'd imagine if they're taking on a married couple, they like that too because you're just healthier in general.
Yeah. Well, that's great. Are there other common pitfalls in this little process? I mean, part of what I think we're getting to is that same place we get to a lot, I think, on this podcast, Roy, which is sometimes it's really helpful to talk to an expert, right? I mean, I know, we got the internet and all that stuff and, and people can do their own research. And I don't think it's that people aren't able to necessarily navigate this themselves. But you also don't have to, especially if you're feeling overwhelmed by it. I mean, I got 20 years to go and I'm already like, oh gosh, that's a lot to think about.
Yeah.
And of course, it's been 20 years, it'll change. So
yeah. Well, there's so many voices out there, right?
Yeah.
To listen to. So I think every quarterback from the 1970s has a commercial now, right? And wanting you to get to call his agency.
Yeah.
And there's social media, and then there's the marketing material. If you're turning 65, expect to get about an inch or two of marketing material. So what do you read? Who do you listen to?
Right.
And at the end of the day, my advice is to get educated, look at both Medicare supplements, look at Medicare Advantage plans, get a game plan together for when you turn 65 so you know what to do, when to do it. So there are pitfalls that you want to avoid. So
yeah, and just that education piece I just want to bring up is just you have to it's unfortunate because you don't have a choice. You're going on Medicare at 65 or if you're working after that. At some point you're going on Medicare, right?
Right.
So you have to educate yourself around it, and that's why this kind of a conversation is so important because people can just listen to it and get a lot of information. And then they can think about their personal situation and they're like, oh, for me, I need to maybe talk to someone about this concept because I'm a little different. And if they do that, they have the best chance of getting in a position that's the most advantage to them and the most, I always tell people flexibility is the key in retirement. So we have flexibility of choice. And if you don't have flexibility of choice, then you're just being told what to do. And that's not an awesome place to live.
Right.
Yeah.
Right.
So,
well,
the other question I have for you, Kent, though, is, okay, so I have a client retiring at, they're 65, they're already on their Medicare, and they have a spouse that's 63, they're not on it yet. How do they bridge that gap if they want to retire together? What do they do?
Yeah, so we talked about that a little bit. First of all, somebody that's working past age 65, they may want to bring on Medicare Part A only. So apply for that. You go to ssa.gov, get Medicare Part A on board, so you have your Medicare number. Then it's just a matter of doing a delayed Part B. So you get those forms, you sign up for Medicare Part B. Now what do you get that going. Now what about the spouse, right? So again, she can elect COBRA. And remember, the whole family does not have to take COBRA. You can divide and conquer that, right? So you can just say, I just want my spouse to take COBRA for, maybe the last few months of the year. Or she can look at the individual market. Right. There's some other plans that are out there. I call them the religious plans, the church plans, like Medicare and some of those things. I represented a couple of those at one point, but you really have to be careful with those plans. You have to ask, they don't cover pre-existing conditions, things like that. They may not cover medications. So rather than representing plans that I have to remember all the things they don't cover, I just say, if you want to go look at those, but have your eyes wide open, ask lots of questions.
Yeah, you get into the kind of like, fringe. I don't mean like bad, but I mean, it's just like there's some ones that are just exist kind of more on the periphery. They're not, kind of mainstream options. You got to, not that they aren't good ones. I actually know some people who use that for healthcare and it's worked for them, but it's a different thing. And, but I mean, to Roy's point, if you're the primary spouse and you're a little bit older, not possessing your primary spouse, I suppose, but if you're the primary breadwinner and you've been the one providing, employer-based health insurance to you and your spouse or whatever, and you're a couple years older, my in-laws ran into this actually. He was a couple years older than she was. He was providing the health insurance. He wanted to retire. She wasn't ready to get on Medicare yet, and so there was some finagling that happened to happen. And this was kind of before the Affordable Care Act and the exchange, and there really was a private market to even go to.
Right.
So that was kind of a big kind of challenge there for them.
Yeah.
Because COBRA is limited in how long you can do it.
Yeah, you can take that up to 18 months.
So if you're within a year and a half, then you can do that. Which of course COBRA continues your employer's coverage, previous employer's coverage.
Explain COBRA, Ken, because I know there's a lot of listeners that probably don't understand COBRA.
Yeah, so if you're on a group plan, the employer is contributing some, and typically the employee contributes some. So when you go on COBRA, you must pay the entire premium. Plus, the employer can charge a 2% admin fee on top of that. So you just take over paying the entire premium, and behind the scenes, typically the employer will terminate you and then add you back as a COBRA member. And then the clock starts ticking.
Right.
18 months.
Yeah.
So if you have a spouse, you retired, they aren't eligible to be on Medicare yet, but you are, they can have up to 18 months to bridge the gap till they get to Medicare?
Correct.
And can they be denied?
They can't be denied COBRA.
Okay. No. So there's no pre-existing issues that happen there.
Yeah.
So that's
if they had been covered before.
Right.
I mean, if they'd already been on the policy.
By the spouses.
Right. Yeah.
And typically you can't change plans. You have to stay on the same plan that you were on. But if you've had an accumulation towards your deductible, that will stay with you.
Gotcha.
Right. So it's a valid option for a lot of people.
Yeah.
But like I said, then again, it comes down to the numbers game. If can you get it cheaper in the individual market based on your income for that year?
Right.
If they say no, it's better to stay on COBRA, well, then what about the next calendar year? What is your income going to be that year? And would a tax credit work better that year?
Right.
In the individual market. So
got it. So you can go on COBRA and COBRA, go on the open market, and then move on to Medicare once you reach 64.
correct.
Yeah.
Okay. So there's so many nuances there, but you really have to look at it and be educated around this stuff to understand it. And, I'm dangerous. And I stay at a Holiday Inn Express, but, I need a Kent to tell me like all of these nuances.
Yeah.
I don't understand it all.
Well, I think this has been really helpful. I mean, again, I always feel like I say this. I learned so much at this. Like my job is to sit here and learn things. Is what I like that about our podcast. So
well, and as we're kind of getting close to the end here, Kent, I'm just curious. You have a business, right? Not everybody's perfect client for you. So what's a typical type of client that you're looking for if people hear this and they're like, oh, I'll call Kent?
Yeah, I do get a lot of referrals from financial planners, as you know. And so people that are approaching 65, again, putting that game plan together. There's a lot of people that sell Medicare plans that don't do that transition process. So, so I think that is a sweet spot for me, people that are approaching 65. And again, people that just want a review of, hey, I have this. Is there anything out there that's any better? Or something's happening in my life. What are my options?
Right.
Can I switch now? There are certain times of the year when you can switch Medicare Advantage plans. So again, just having somebody in your back pocket that you can call is kind of nice.
Well, and that's full disclosure. I have referred people to Kent, and I always check for feedback, by the way. You're here for a reason.
I tell them if it's negative, then don't
tell
report.
them, right?
If it's less than 5 stars, I don't want it.
Yes, but the thing I've appreciated though for the people who have given me feedback, Ken, is that you really educate people and just try and help them make a good decision that's best for them. And that's how I approach my business too. Is just I want to educate people and let them make an educated, informed decision.
Yeah,
and that's been fantastic. And the reason we're kind of doing this this time of year here in the fall, early fall, I guess late summer. There's some dates coming up here that are important. What we got coming up later this year?
So mid-October, typically CMS, which is Center for Medicare and Medicaid Services, will announce what the changes are for next year.
Oh, okay.
So what's the Medicare Part B deductible going to be, and what's the premium going to be? One of the other things that's coming up in 2025 is the Affordable Care Act that was signed back in 2022. Some of those changes are going to happen in 2025, and particularly around the prescription drug plans.
Oh.
So it's going to be a big year for brokers like me. We're analyzing as we speak what's happening in the drug plan area. So we know that the Part D drug deductibles are going from $545 to $590. We know that the coverage gap or the donut hole is going away. And again, what that means is in 2024, people that took some very expensive medications, on Medicare, they had to pay out of pocket all the way up to about $8,000 before the insurance company paid 100%. That's coming down to $2,000. And so the health plans are going to have to absorb that cost. Right?
Oh, okay.
So the government's going to be spending more, but also the health plans have to adjust their prices for those drug plans. So along with that could come multiple changes. There could be pharmacy changes, like which pharmacies are in network, right?
Right.
There could be formulary changes. All kinds of things could be happening. So anybody that's on medications will really want to check those in 2025.
Okay.
Sounds like a follow-up conversation here, Kent.
There you go. I know.
Anything the
Have
government
Kent
gets their
back.
hands in, right? The convolution that we
Yeah.
experience and the unclarity of
Yeah.
it. So you guys are really working. Your industry's kind of working through figuring out what that means.
Yeah.
Will you know that before 25, or will
Oh, yeah.
you guys will kind of have a good idea
Yeah.
before you get your new premium
Yeah,
numbers?
we
and everything?
get initial peeks at it right now. And then October 1st, we can start talking to our clients about it. And October 15th, we can actually start writing applications for plans that go into effect January 1st.
Okay. Okay. So if somebody wants to find you, Kent, where do they find you?
So I have an office in South Fort Collins,
Okay.
off of Harmony and Boardwalk.
Okay.
And of course, my phone number.
Yeah.
Is it okay for me to give that?
Absolutely.
If you'd like to give it.
If you'd like to give it, maybe website too.
Yeah, phone number 970-225-8282.
Yeah.
And
And it's KDMins.com. So
Yeah.
KDMins.com.
Yep. So KDM Insurance.
Insurance.
In shortened, yep. KDMins.com.
No socials, Kent?
Social media?
Yeah. Get the Insta?
I don't. I don't.
Oh, man, Medicaid Insta.
I don't know that his generation of folk are into the Insta.
Probably not.
Maybe
Facebook.
Maybe Facebook.
Facebook. I can tell you around the church who's on Facebook, and it ain't the teenagers.
Oh, you guys targeted me perfectly.
Yeah.
I have a Facebook account, but nothing else.
Yeah. You're not the only one. It's
You can
okay.
guess how old I am.
Yeah.
Yeah.
You almost can. So, yeah. If you throw me for a loop, if you told me you had Snapchat. So, well, good. Well, I really appreciate you coming on. I love it when we can have these guests and fill in some knowledge, for us and our vastly growing audience. Sure.
Yeah, and I look forward to feedback on this too, because I'm sure there's gonna be more questions. And anybody out there that does have questions, feel free to post them on wherever you're listening to this, and we'll definitely push that forward, because I'm sure we're gonna have some follow up with you with some changes, and that sounds like a future conversation at that point in time. But really, thank you, Kent, for coming on and educating us. And that's a lot of information.
Yeah.
I mean, that's a lot of information for folks that have never really thought about it.
Yeah. And if you're not in the area, I'm sure you can track down a Kent of your own, in other places. Maybe that's the final kind of question. If people are like in far-flung places, want to deal with somebody a little bit more local. I mean, the great thing about the internet and podcasts is it goes everywhere. Do you have tips for people on how to find the right kind of person? If we're sitting in, Sheboygan, wherever that is, and we're like, how do I find my own Kent? Like, what should people be, or what should people be cautious about? I don't know how we want to put it.
Yeah, so right now I'm actually licensed in Colorado, Wyoming, and Montana.
Oh,
I've got
all the great states.
Yeah, I have some really good friends that are licensed in maybe 11 states.
Okay.
And then I do know a person that's licensed in all 50. That's pretty good. Navigating that transition into Medicare, I tend to excel at that and do a lot of work, which, to be honest, is unpaid.
Right. Yeah.
So that's kind of anticipating someone will come back to me and actually buy a product.
Right.
So I get paid. But so again, finding somebody maybe asking those questions up front. Hey, I need a little help transitioning into Medicare.
Right.
Are you the kind of broker that does that?
Versus like right into the sales pitch.
Yeah. Once you have your Medicare number, come talk to me. Well, wait a minute.
Yeah, I need some help with that.
Yeah. Right. I don't even know. Yeah.
Right.
Yeah, that makes sense. Well, we do really appreciate you coming on, and you can always find Roy and I and everything we've been doing on the aboutpodcast.com, and we got a lot of previous episodes and more fun stuff and important stuff coming on, and I guess we don't really have a sponsor today because we have Kent.
Yes. Yes, we do have Kent.
We don't really have sponsors anyway, but we like to throw some shout-outs out there, but you're our shout-out today, so I love it. So.
Yeah.
All right. Well, Ken, thank you for joining us.
My pleasure.
Roy, pleasure as always. And thank you everyone out there for listening. Don't forget to, like, subscribe, share it with your friends, especially if you found it interesting. Post it on your social medias of choice.
Facebook, preferably.
Facebook. We do love some Facebook around here. And appreciate everybody tuning in.
Thanks, everybody.
Thank you.